6 years ago, I went to see, my wife made me go see a cardiologist as preventive, and he did a stress test, and I failed it.
At another facility, he was told that he was going to need coronary artery bypass graft surgery.
Which was a little shocking because I was doing this more as preventative than for symptoms of like heart attack or anything like that. When I was in the recovery room, that hospital sent up a surgeon who was kind of pushy to try to get me to do the surgery immediately, and was saying things that were really scary, and I didn't feel that the information that was being given to me was really for the right motivation purposes. I went to Dr. Pastor, who's the cardiologist here.
What we did in the cardiac catheterization laboratory was use a special system that objectively tells us whether that vessel and that area of the heart needs to be revascularized. In other words, needs to be propped up or keep open to improve the blood flow. Only one vessel in his heart needed to have the revascularization, and so he underwent a successful coronary intervention. That is that we put a stent via a robotic use to be precise, to be basically selective in the area that we want to be working. The robotic arm allowed us to have that precision. He had a very successful procedure, and now after a few months for the procedure, seeing him happy without any symptoms, exercising, and kind of like recovering his life.
It was the following day I went to work and there was no issues. To have triple bypass, you're probably looking 6 months, a year by the time you're trying to get back to normal, compared to doing this procedure where the next day you're feeling the difference between before and after. The people here were more caring than other places that I've been in. I wanted to make sure I went to somebody that was thinking more about my best interest than the business.
Very few centers will have the dedicated team that we have, and we all make a consensus about the situation of the patient and what is going to be best for him. And that's what he liked about Memorial.
The people I've met here and the views that I would refer them to anybody, my family, my friends. They're good people here.